Almost 9,000 people in the UK have now lost their lives to coronavirus in the past 5 weeks. The latest daily death toll has risen by a record 980 people. That's higher than Spain and Italy's worst daily death tolls. And that number does not include people who have died from coronavirus in care homes or in the community. It brings the total number of deaths in hospital to 8,958 at the end of another week of tragic news for thousands of families across the country. Today has been the third day in a row in which the government has announced close to 1,000 deaths in a single day. Meanwhile, despite fresh claims from frontline staff about a lack of personal protection equipment, the Health Secretary today insisted there is now enough for medical workers as long as it's used correctly. Here's our health editor, Hugh Pym.
He warned about the lack of protective equipment for NHS staff. Soon after that, Dr Abdul Mabud Chowdhury contracted coronavirus. He died on Wednesday. The warning came in a social media message to the Prime Minister, saying health workers had to protect themselves and their families. His son spoke to the BBC today.
He was a courageous, brave man, and that is something that he's passed on to us. He saw that NHS workers didn't have enough PPE, and he made a call for that. He wrote a letter for that, and well, maybe at the time it didn't get the attention it deserved, but now, for sure, we are giving it the attention it deserves, and we are not going to stop. We are getting this everywhere. We are making sure we're heard, that my father's voice is heard, and that my father's passing is not in vain.
Problems getting hold of the right masks, gowns and visors have been reported for several weeks. The government said there were enough supplies and distribution would be improved. But still, some feel anxious they can't obtain appropriate personal protective equipment known as PPE.
We're getting a lot of messages from doctors on the front line that the current situation is, in many parts of the country, inadequate. The people are feeling unprotected, that they feel scared when they're at work. They feel unable in some places to use the kit that they're able to bring in from home because other members of the team haven't got it, and that they don't feel confident in what's being provided.
Staff at one trust say they've had conflicting messages, with guidelines on whether to use an apron or gown changing twice in 2 hours. A doctor told us, "I feel betrayed by those who are meant to be our leaders. It's like we're being sent to war without armour to protect ourselves, serving as cannon fodder." In a statement, the Newcastle-upon-Tyne Hospitals Trust said requirements from Public Health England had changed numerous times over recent weeks, that current advice was fully in line with those, and staff could be assured there were sufficient supplies of protective equipment. Today, the government announced a new plan to boost PPE supplies, including a plea to businesses to produce more.
If you've got production facilities and you can meet our published technical specifications, we want to hear from you so that we can make this kit here in Britain that'll keep people safe.
There will be a lot of scepticism, won't there, still, about another plan being published. What guarantees can you give that people will be made to feel safe with the right equipment?
What I'd say is that it is a constant effort to get the PPE to the front line, a huge logistical effort. We acknowledge the challenges, of course we do, we face them every day, and we are doing everything in our power to get that PPE to the front line.
And there was a sobering assessment of the latest data on the spread of the virus.
We are in a dangerous phase still, and I need to reinforce that again to you, that this is not over.
Scotland's First Minister, who toured the new temporary hospital for coronavirus patients in Glasgow, repeated the guidelines to the public on social distancing.
The message remains exactly the same as it has been. People need to stay at home. I know how difficult that is, and I know how difficult that will be, particularly over this Easter weekend. Ordinarily, that is a time to see friends and family, it's a time to get out and about or even take a short break. None of that will be possible this year.
Today, some were enjoying the sunshine, keeping their distance and exercising in line with official advice. But there's still a long bank holiday weekend ahead. Hugh Pym, BBC News.
And Hugh is with me now. Another terrible death toll, daily death toll here in the UK, and it comes on the day when the global death toll has now surpassed 100,000 people. Is there any sign that the situation here could be starting to ease?
Yes, Sophie, more shocking figures, and it seems likely the death toll will rise above 1,000 in the UK in terms of new cases each day. The experts look ahead at hospital data, particularly to see whether we're reaching something close to the peak of this epidemic. And there was one chart shown today at the Downing Street briefing on critical care bed usage, patients in critical care, intensive care in the UK. And you can see that London number in red there is coming down a bit. The Midlands has flattened. Scotland and Wales are flat as well. Now that is being seen as a little bit of a tentative sign that things at least are beginning to plateau. But Jonathan Van Tam, the Deputy Chief Medical Officer for England, we heard earlier saying that it was still a dangerous situation. Of course, protective equipment is another issue that's cropped up today. Matt Hancock acknowledging it was a similar problem as with ventilators and testing. It needed businesses to come in and help scale up what was available to NHS staff. He hasn't said that before. I think it may need a bit of time for NHS frontline staff to be convinced that that equipment really is being made available to them.
Hugh Pym, thank you. Well, temperatures are forecast to hit 26 degrees in some parts of the UK tomorrow, and the government has repeated again the need for people to stay at home unless they go out for the following reasons. You can leave home to exercise once a day locally, alone or with members of your household. There is no set time limit on this. You can shop, but only for basic necessities and as infrequently as possible. And you can go out for any medical need or to provide care for a vulnerable person. You can also travel to or from work, but only if you can't work from home. Our correspondent Fiona Trott reports now from Scarborough.
A picture postcard, and that's because the crowds are missing. What would have been unusual is now the norm.
You wouldn't be able to move down here. Honest to God, you wouldn't. It'd be absolutely heaving. Chock-a-block, beach, pathways, all the shops would be busy, everything.
You know, we're not asking a lot. It's only for a short time, it's not forever.
We both work at the hospital, so in terms of people staying away, this is what we need. You know, our town and every town, certainly on the seaside, we need people to stay at home, keep away, keep themselves safe, to keep us, the NHS, safe, so we can save people's lives.
And it wasn't just Scarborough that was deserted. Other coastal towns were empty too, from Southend-on-Sea in Essex to Southwold in Suffolk, to Skegness in Lincolnshire, where on a normal Easter weekend it would be impossible to find a parking space. Today, a different story.
Sir, no running. That's it. Can only walk on the river walk.
In London, council officials have been reminding people to keep their distance when they're out.
Sir, can you dismount, please? Thank you.
In Birmingham, rangers have been patrolling the parks.
If you're sitting on the bench, you're all right walking around, but staying stationary. Are you from the same household?
Doing their bit to enforce the rules on social distancing.
Stay indoors because of COVID-19.
So you're saying I'm not allowed on my front garden?
You cannot come on your front garden.
But in Rotherham, police were accused of taking things a little too far. South Yorkshire Police have since apologised and described the incident as well-intentioned but ill-informed. Messages like these in Scotland have been seen across the UK's tourist spots. And they appear to have made a difference. Keswick today, a ghost town. The message to stay at home being heard by all.
Right now, you have to remember there's still a lot of virus circulating, and if we keep ourselves away from other people, the only way you're going to get it is from an infected person. So staying apart from other people is the key to breaking the transmission chain.
And it doesn't get more isolated than this. It's hoped the Easter weekend will look exactly the same. Fiona Trott, BBC News.